So let's clear this up right now, Secretary Kennedy. Will you tell America that all adults and all children over 6 months of age are eligible to get a COVID booster at their local pharmacy today?
As I said, I'm not taking vaccines away from anybody.
Okay, same answer, right? You're just going to deny that when people can't get access, that you're not taking it away. Then let me ask you, is that the same game you're going to play with measles,
you want me to recommend every product in the world?
As Senator Dr. Cassidy said, you are effectively denying people vaccines.
We're not going to recommend a product for which there's no clinical data for that indication. Is that what I should be doing?
What you should be doing is honoring your promise that you made when you were looking to get confirmed in this job.
You're going like this.
And that is, you promised.
Last November, Health Secretary Robert Kennedy promised he would never take vaccines away from anyone who wanted them, but now he's under fire for changing federal policy on the COVID-19 vaccine, declaring it no longer recommended for healthy people under 65. During a tense Senate hearing, lawmakers accused Kennedy of breaking his word, since the new guidance means pharmacies in some states can't administer the vaccine and insurance companies may refuse to cover it. Kennedy defended his decision, arguing there's no new clinical data to justify ongoing boosters for that group, and insisting he's not taking vaccines away. Anyone can still request them. The clash escalated when senators accused him of firing a CDC official who opposed the change. Critics say Kennedy's move undermines public trust and limits access to care, while supporters call it a return to evidence-based policy.
Thank you, Mr. Chairman. So, last November, while you were under consideration to become Secretary of Health and Human Services, Mr. Kennedy, you said, quote, if vaccines are working for somebody, I'm not going to take them away. No exceptions, no ifs, ands, or buts. You would not take away vaccines from anyone who wanted them. Then last week, you announced that the COVID-19 vaccine is no longer approved for healthy people under the age of 65. In announcing the change, you said the vaccine will be available for anyone who wants it. Now, obviously, both things cannot be true at the same moment. So let's clear this up right now, Secretary Kennedy. Will you tell America that all adults and all children over 6 months of age are eligible to get a COVID booster at their local pharmacy today?
Anybody can get the booster.
I'm sorry?
Anybody can get it, Senator.
Anybody. So you're saying that is now the official rule of HHS. Anybody is eligible to get a booster by just walking into the pharmacy.
It's not recommended for healthy people.
No. If you don't recommend, then the consequence of that in many states is that you can't walk into a pharmacy and get one. It means insurance companies don't have to cover the $200 or so cost. As Senator Dr. Cassidy said, you are effectively denying people vaccines.
We're not going to recommend a product for which there's no clinical data for that indication. Is that what I should be doing?
What you should be doing is honoring your promise that you made when you were looking to get confirmed in this job.
You're going like this.
And that is, you promised that you would not take away vaccines from anyone who wanted them. You just changed the classification of the COVID vaccine.
I'm not taking them away from people, Senator.
It takes it away if you can't get it from your pharmacist.
Well, most Americans are going to be able to get it from their pharmacy for free. Most Americans will be able to get it from their pharmacy for free.
The question is, everyone who wants it, that was your promise.
No, I didn't. I never promised that I was going to recommend products for which there is no indication.
When you said...
And I know you've taken $855,000 from pharmaceutical companies, Senator.
Did you hold up a big sign saying that you were lying when you said that? Because you are the one who said you would not take them away. Now, Senator Kennedy,
I'm not taking them away from anybody.
Secretary,
You want me to indicate a product for which there is no clinical data?
Senator,
Is that what you want?
Secretary Kennedy, you said you wouldn't, and now you did.
I'm not taking them away.
Obviously-
Everybody can get access to them.
No, they can't walk into a pharmacy the way they could last month and get access to
It depends on the state. It depends on the states.
A year ago,
But they can still get it. Everybody can get it.
A month ago, it did
Everybody
not
can
depend.
get it, Senator.
So look, let's move on. You clearly are taking away vaccines. I've seen the list for what's coming up next, and that is the agenda for the next CDC vaccine panel. And first up is ratifying your COVID actions. Second is hepatitis B is on the agenda. So should Americans expect you to take away hepatitis vaccine access as well, even though you promised not to?
As I said, I'm not taking vaccines away from anybody.
Okay, same answer, right? You're just going to deny that when people can't get access, that you're not taking it away. Then let me ask you, is that the same game you're going to play with measles,
you want me to,
mumps,
so you want me to
rubella,
recommend
chickenpox?
every product in the world so that without any clinical trial data?
Through on your promises.
Yeah, my promise was to give.
A month ago, we could get COVID vaccines by just walking.
You can
into a
still get
pharmacy.
COVID vaccines,
You
Senator.
are taking that away.
No, you are
So let
still. You
me
can
ask
still
you
get the
one more
COVID vaccines, and
question,
Medicare
Secretary
will still
Kennedy.
pay for them, and Medicaid will still
Tell the
pay for
head
them.
of the CDC that if she refused to sign off on your changes to the childhood vaccine schedule, that she had to resign?
No, I told her that she had to resign because I asked her, "Are you a trustworthy person?" And she said no. So if you had an employee who told you they weren't trustworthy, would you ask them to resign, Senator?
So I'm sorry, but this is not what she has said publicly. She has
Well,
said
I'm
she
not
was
surprised
told to
about that.
reapprove. So you're saying she's lying?
Yes. Every conversation I had with her, there
And
were
let me get
witnesses.
this straight. This is the same person that less than a month earlier, you stood next to her and described her as unimpeachable. And you had full confidence in her, and that you had full confidence in her scientific credentials. And in a month, she became a liar? Is
Yeah,
that what
you
you're
should
saying?
ask her what changed. And by the way, a month ago, you were voting against her. Oh, because you thought she was either incompetent, ineligible, or unsuited to the task.
I voted
Now I
against her
agree
because
with
I
you.
was afraid she was going to bend the knee to you and Donald Trump. And it looks like she didn't bend the knee, so you fired her. Look, you're putting America's babies' health at risk, America's seniors' health at risk, all Americans' health at risk, and you should resign.
Senator Sanders.